Hello, Medicos. Good day to all of you. So, this is Dr. BK for you, and today I am going to discuss about a very important topic on the thorax region, that is the blood supply of the heart. So, in the previous classes, I have been discussing in detail about the various features of the heart both internally and externally. Now, for the heart to function normally, the blood supply is very much necessary, needed, and it is inevitable because it is through this the heart muscle receives its nutrition. So, with respect to the blood supply of the heart, our learning objectives for today will be a short introduction about the blood vessels, the nature of the blood vessels and how actually they supply the heart musculature. Followed by that, the major discussion on today's topic will be about the two main arteries, that is the right and left coronary arteries, and these two arteries I will be discussing about their origin, course and their branches of the both the right and the left coronary arteries. Followed by that, we will see little bit about the venous drainage of the heart also, and finally the applied aspects. Now, coming to the blood supply of the heart, we all know that the heart is supplied by two arteries, mainly the right coronary artery and the other one is the left coronary artery. Now, we all might wonder, the heart pumps blood to whole of our body. Does heart requires a blood supply separately of its own? Definitely this is necessary because even though all the chambers of the heart are filled with blood, this blood cannot permeate into the walls of the heart. Now, the interior of the heart is actually called as the endocardium. Then you have the thick musculature, which is the myocardium. Followed by that, you see the epicardium. Now, these main trunk of the vessels are actually seen in the epicardium. And what happens is the interior blood which is present in the chambers can only nourish the internal approximately 1 millimeter of the internal wall, but the remaining thick musculature needs its blood supply. So only this part alone can be nourished, but see the thick musculature, that is the myocardium, definitely requires a exclusive blood supply for this tissue to be alive and to pump the blood effectively. Okay. Now, for this only these two arteries, the right and left coronary arteries, are actually present. Now, the right and left coronary artery can also be called as the vasovasorum. What is vasovasorum? Means a blood vessel supplying a blood vessel. Our heart itself is like a blood vessel. It is basically a fusion of two blood vessels. Ventral aorta, they are fused. They have undergone so much of modifications. The primitive heart tube has gone looping of the heart, bending, and finally it has attained this final position. Okay. So, even though it appears conical, muscular, organ, all those things, it is basically a blood vessel. So, the right and left coronary arteries are the two blood vessels supplying the blood vessel. Okay. Now, second thing with respect to the nature of the coronary arteries, you can see so many branches. They are giving rami, various atrial rami, ventricular rami. They permeate through the epicardium and then to the myocardium also. But the anastomosis, they are actually potential anastomosis. Anatomically they are present, but physiologically what happens is it is impervious. That means there is actually no passage of blood taking place at the capillary level. Only at the precapillary level the anastomosis are present. And most of these anastomosis are actually impervious. So, even though structurally rich anastomosis is present, blood is not actually traversing through this anastomosis. So, that is why man actually suffers ischemic heart diseases. Okay. So, and as I told you, the coronary arteries are nothing but vasorum, and they arise from the ascending aorta. Okay. So in the left ventricle we have seen about how the ascending aorta originates as an outflow tract. It is called as the vestibule, and you are able to see inside on the depth of the valves, the semilunar valves of the aorta, 3 openings, of which 2 are actually coronary sinus, which gives origin to these 2 arteries. And one more peculiarity you have to remember about this is the whole of the body gets its blood supply when the ventricles contract. So that is during the systole. When the ventricles contract, blood is actually pumped out of the left ventricle into the aorta, and then it reaches to all parts of the body through the various branches. But when does the heart itself gets its blood supply? It is only during the diastole. So it is the right and left coronary arteries are the only arteries which are filled during the diastole. So when the heart relaxes, when the semilunar valves of the aorta, ascending aorta approximates, then in the cusps of that valves blood is collected, and that blood enters into the coronary arteries. So with the short introduction, I will directly pass on to the right coronary artery. The right coronary artery actually arises from the anterior aortic sinus or right coronary sinus. In clinical usage, you call it as the right coronary sinus, which is from the anterior aortic sinus. There are 3 aortic sinus: anterior aortic sinus, and then you have the left coronary sinus, left aortic sinus. Then you have the right posterior aortic sinus, which is a non-aortic sinus. It arises from the anterior or right coronary sinus, and it is present between the right auricle and the pulmonary trunk. Then from there, it actually runs in the atrioventricular groove. That is the right part of atrioventricular groove towards the inferior border of the heart, along the right part of AV groove, are also called as the coronary sulcus, up to the inferior border of the heart. Then from there, what happens is it winds around the inferior border of the heart and runs in the posterior part of atrioventricular. So from here, then you are able to see it runs in the posterior part of atrioventricular groove near to the apex of the heart. So you know that what is apex of the heart? It is the meeting point of atrioventricular groove and interatrial and interventricular groove. Sorry, it is not the apex of the heart, the crux of the heart. Kindly excuse for that short mistake. So crux of the heart, what I meant, in the crux of the heart, it ends by anastomosing with the circumflex branch of left coronary artery. It anastomoses with the circumflex branch of left coronary artery. Now, the termination of the right coronary artery is variable. First, what I described about this termination right now is most common, occurs in 70% of the subjects. That is, at the crux, it anastomoses with the circumflex branch of left coronary artery. The other modes of termination is seen in 10% of the people. It might end somewhere near the inferior border of the heart itself, or sometimes it might traverse the whole of the atrioventricular groove, replacing the circumflex, or sometimes it might terminate midway between the inferior border and the crux. So these are the other variable modes of termination of the right coronary artery. So for the sake of description of the branches, we can divide the right coronary artery into two segments. First segment, what we saw anteriorly from the origin to the inferior border. The second segment is from the inferior border to near to its termination, that is at the crux of the heart. Okay. So now again we are seeing the right coronary artery. The first are the segment. Each segment, whether it is the anterior segment or the posterior segment, has got atrial and ventricular rami. So these are the branches, ventricular rami and the atrial rami, which traverse and supply the right ventricle and the right atrium. The first ventricular branch is the right conus artery. The right conus artery supplies the infundibulum of the right ventricle, right conus artery. Sometimes the left conus artery, which is from the left coronary artery, they anastomose with the right conus artery, and that is actually called as the annulus of Lucens. It forms a vascular ring like a necklace, and that is actually called as the annulus of Lucens. It is the anastomosis of right conus artery and from the left conus artery, which is the branch of left coronary artery. So we are discussing about the anterior segment or the first segment, of which the ventricular rami, first branch is the right conus artery. Sometimes the right conus artery arises directly from the anterior aortic sinus. In that case, it is called as the third coronary artery. Okay. So variations are always there in the human body. Okay, so third coronary artery, sometimes if the right conus artery arises directly from the anterior aortic sinus. Now let us discuss about the other ventricular rami branches. Right anterior ventricular rami, they ramify on the sternocostal surface of the right ventricle. One of the anterior ventricular rami of the right coronary artery is very large, and it is called as the right marginal artery. Okay, largest branch of the ventricular rami is actually called as the right marginal artery. The right marginal artery runs along the inferior border of the heart near to the apex. It is seen. Okay, so we have discussed about right conus artery. Then we have discussed about the right marginal artery. Okay. The next branch which we are going to see about the right coronary artery is the atrial rami. The atrial rami mainly supplies the muscle of the right atrium or the myocardium of the right atrium. And one branch is the sinoatrionodal artery or the SA nodal artery. So it passes here between the ascending aorta and the right atrium. Then it winds around the opening of the superior vena cava, in front of the opening of the superior vena cava, and supplies the SA node. This type of arrangement is seen mostly in the 65% in the majority of the population, where the SA nodal artery is a branch of the right coronary artery from the atrial rami. In 35% of the cases, the SA nodal artery is a branch from the circumflex artery. It's a branch from the circumflex artery. So, supplies the SA node or the pacemaker of the heart. Now, coming to the posterior segment, again you have ventricular rami and atrial rami. The ventricular rami are 3 to 4 in number. They are also arranged in groups, anterior, lateral, posterior groups. Right posterior ventricular rami arises from the right coronary artery, the posterior part of atrioventricular groove, and one of the largest branch is the posterior interventricular artery. Okay. The branches arising from the posterior part of the right coronary artery, ventricular rami, they mainly supply the diaphragmatic surface of right ventricle. Right ventricle. So we are discussing about the posterior segment or the second segment of the right coronary artery, of which ventricular branches. One of the branches is the posterior interventricular artery, which is seen in the posterior part of interventricular groove, and at the lower part of the groove it anastomoses with the anterior interventricular branch of the left coronary artery. Posterior interventricular artery anastomoses with the anterior interventricular branch of the left coronary artery, and that is actually seen again in the 70% of the subjects. Based on the branching of the posterior interventricular artery. Posterior interventricular artery normally is a branch of the right coronary artery. Based on these branching, we can decide about the coronary dominance. So, usually in 70% of the subjects, we are right coronary dominance. That means the posterior interventricular artery is a branch of right coronary artery. In 10% of the cases, what happens is it is left coronary dominance, because the posterior interventricular artery is actually given by the circumflex branch of the left coronary artery, or you call it as left circumflex artery. So if it is from left circumflex artery, they are actually left coronary dominance. Those subjects are actually left coronary dominance, but usually it is right coronary dominance. Now, here you are able to see the two coronary arteries. This is the right coronary artery, mainly supplying your right part of the heart, right ventricle, especially the right ventricle, except a strip along the anterior interventricular groove. The whole of the right ventricle, including the diaphragmatic surface, is supplied by the right coronary artery. Left coronary artery mainly supplies your left ventricle, except a strip over the posterior interventricular groove and the diaphragmatic surface of the heart. Now, the right coronary dominance is what happens is the normal found in majority of the populations. I told you in 10% what happens is if it is left coronary dominance, then the whole of the left ventricle is under the control of left coronary artery, and the whole of the interventricular septum also. Okay, posterior inferior part of the interventricular septum is supplied by the posterior ventricular rami, of the right coronary artery. Anterior superior part of the septum is by the left coronary artery, meaning the anterior interventricular branch. If the circumflex artery is going to give posterior interventricular, then whole of the left ventricle comes under the control of the left circumflex in that 10% of cases. So any coronary artery disease or ischemic heart disease, then the whole of the left ventricle, including the ventricular septum, might undergo infarction, and there will be a failure of systemic output. Now, in certain set of population, the posterior interventricular is actually given by both right and left coronary arteries, that is balanced type of circulation, and this group of people are actually advantageous. Okay. So they are least to be suffered from the ischemic heart disease. That is about the coronary dominants. Okay, so majority of the people are right coronary dominants because right posterior interventricular artery arises from the right coronary artery. So we are discussing again, continuing with the right coronary artery, posterior ventricular rami, posteriorly we have seen. Of these, the posterior interventricular, it supplies the interventricular septum and also the AV node. The first ventricular rami also supplies the AV node, atrioventricular node or AV nodal artery. So both the sinoatrial node, SA node and AV node is again under the control of the right coronary artery. Posterior atrial rami mainly ramify onto the posterior surface of both the right atrium and also the left atrium and supply both the right and the left atrium. Okay. So that is about the left coronary artery. So the branches, to summarize the left coronary artery, we have seen about the right conus artery. Then we have seen about the right marginal artery. Then we have seen about the sinoatrionodal artery. They are the atrial rami. Posterior segment, we have seen about the posterior interventricular artery. Then AV nodal artery. Then we have seen about what is coronary dominance based on the branching of the posterior interventricular artery. Next, coming to the left coronary artery, it is more wider than the right coronary artery. Second thing, it supplies more amount of the myocardium as compared to the right coronary artery. Okay, because you all know that left ventricle is more thicker. It is 3 times more thicker than the right ventricle. So it supplies a lot of myocardium or muscle of the heart, left coronary artery. Arises from the left posterior aortic sinus. Arises from the left posterior aortic sinus. Sometimes it might arise from the anterior aortic sinus. In that case, if it is anterior aortic sinus, it has to take a longer course between the left atrium and the ascending aorta. And occasionally what happens, it might get compressed between these two structures, leading to sudden cardiac death, SCD or sudden cardiac death. So normally it arises from the right posterior aortic sinus, or also called as left coronary sinus in clinical usage. So wider than coronary, right coronary artery, and supplies larger volume of the myocardium. Passes between the left auricle and the pulmonary trunk. Between the left auricle and the pulmonary trunk. Very short course. The trunk of the left coronary artery has got a very short course, and immediately it bifurcates into the left anterior interventricular artery and the left circumflex artery. Okay. So the trunk of the left coronary artery is very short and immediately bifurcates or divides into anterior interventricular and the circumflex branch of left coronary artery. Not only that, the left coronary artery does not give any significant branches. The trunk of the left, I mean the trunk of the left coronary artery, the main trunk, does not give any branches. So sometimes these two arteries might arise directly from the left posterior aortic sinus. Instead of left coronary dividing into two, from their origin itself they might arise as two separate branches. Now coming to the branches of left coronary artery, the main branch is the ventricular rami, is the anterior interventricular artery, considered as the continuation of the left coronary artery. Mainly supplies the left ventricle and also supplies the anterosuperior part of the interventricular septum, seen in the anterior interventricular groove and runs towards the apex along the incisura apicis cordis, then goes to the posterior part of the interventricular groove, and anastomoses with the posterior interventricular branch of right coronary artery. Okay, so that's what I told you. Points around the incisura apicis cordis and ends by anastomosing with the posterior interventricular branch of right coronary artery. Now, we are discussing about the anterior interventricular artery, considered as the continuation of the left coronary artery. One of the branch is large and actually it is called as the diagonal artery. It is called as the diagonal artery, one of the anterior ventricular rami. It arises from the junction of the anterior interventricular and circumflex branch. Sometimes it might arise directly. In that case, the left coronary artery, instead of bifurcating, it might trifurcate, dividing into 3 branches. Diagonal branch directly arising from the trunk of the left coronary artery. Next is left conus artery, supplies the infundibulum of the right ventricle. I told you, like right conus artery or left conus, and both might form a anastomosis, which is actually called as the annulus of Lucens. Okay, so anterior interventricular artery mainly supplies your left ventricle along a small strip of the sternocostal surface of the right ventricle, anterosuperior part of the interventricular septum, and one of the ventricular rami is large and it is called as the diagonal artery. So as I told you, septal branches supplies the anterosuperior part of the ventricular septum. The next we are going to discuss about the circumflex. Circumflex means winding around. So left circumflex artery, so passes along the left part of the atrioventricular groove or coronary sulcus, reaches near the left border of the heart, winds around the left border of the heart, traverses the posterior part of the atrioventricular groove or coronary sulcus and anastomoses with the trunk of right coronary artery near the crux of the heart. The left coronary artery, again one of the branch, is very long and it is actually called as the left marginal artery. The branches arising as ventricular and atrial rami supplies the adjoining surfaces of the left atrium and the left ventricle. One of the ventricular rami is very long and it is actually called as the left marginal artery. So in coronary arterial bypass graft, the venous graft is actually anastomosed to the left marginal artery. Okay. Then it gives in certain percent, apart from the 65% of the subjects, the remaining 35% of people or population, the sinoadenodal artery, sinoatrial or SA nodal artery is a branch of the circumflex artery. It is a branch of circumflex artery. Then I have discussed about the left marginal artery. Okay. Then in 20% of the cases, the posterior interventricular artery is actually a branch from the left circumflex artery. So as I told you, then these people will be of left coronary dominance. Left coronary dominance. There is also one more artery which is called as Stuyvesant's artery. An atrial branch from the left circumflex will anastomose with a similar branch of the right coronary, atrial branch of right coronary artery, and that is actually called as Stuyvesant's artery. So left coronary artery bifurcates into left anterior interventricular artery and left circumflex artery. One of the branches of the ventricular rami are the left diagonal artery, then left conus artery. Circumflex artery gives to SA nodal artery and the right marginal artery. Sometimes in certain amount of population, the left circumflex artery also gives rise to posterior interventricular artery. So, to summarize, the area supplied by right coronary artery, it mainly supplies most of the right atrium, sternocostal surface of the right ventricle, and also the diaphragmatic surface of the right ventricle. So most of the right ventricle except along the anterior interventricular groove and posterior inferior part of ventricular septum. Left coronary artery supplies left atrium, most of the left atrium except the posterior surface, then left ventricle except a strip along the posterior and inferior surface, interventricular groove, that area, and anterosuperior part of ventricular septum. Anterosuperior part of ventricular septum is supplied by the left coronary artery. Right coronary artery, apart from that, also supplies the SA node and AV node, sinoatrial node and atrioventricular node. Now coming to the applied aspects, ischemic heart disease, occlusion of the coronary artery. Atherosclerotic plaque might develop subendothelial deep to the endothelium, and naturally they might produce thrombus. So then the lumen of the artery gets blocked. When the lumen of the artery gets blocked, there is no blood supply through its branches, and the muscle tissue suffers lack of blood supply. It is called as myocardial infarction. It is called as myocardial infarction. If there is transient occlusion, temporarily or spasmodic occlusion of this artery, then you get a pain which is called as angina pectoris or heart pain. Now, what are the most commonly occluded arteries? LAD, left anterior descending, which is nothing but your anterior interventricular branch of left coronary artery. So this is the order of the occlusion. Most commonly occluded is LAD. So, and definitely what happens, anterior inferior part of your ventricular septum, anterior superior part of your ventricular septum, and most of your left ventricle, myocardium suffers infarct. Infarct is developed. The next is RAR, right coronary artery, and next is LCX or circumflex branch. These are the three most commonly affected, and sometimes if there is block in these three, it is called as triple vessel block. It is called as triple vessel block. Now, if the block is sudden, complete occlusion, then again death results. If it is gradual, then naturally what happens is it can be treated with various treatment or therapeutic options. And if it is gradual and in aged persons, in elderly people, the prognosis is very good, because as the block occurs gradually, the anastomosis becomes pervious. Lot of anastomosis develop as time advances because there is a block, and it also becomes pervious to the blood. Okay. So that is why in elderly persons, if it is a gradual accumulation, then naturally the prognosis is very good. So coronary angiograph, you inject a dye, and then what happens is you see how the coronary arteries are filled, and that procedure is actually called as coronary angiography. So there you can see a filling defect, and here actually you are able to see the lumen is clear. There is no filling defect, so that means there is a block here. Now, how actually these blocks can be removed? There are two preferred treatment options, procedure. One is actually transluminal angioplasty. Repairing of the blood vessel is actually called as angioplasty. You insert a catheter, and then what happens is you inflate with the help of a balloon. When you inflate it, all the blocks or the atherosclerotic plaque might break away. and naturally what happens is the lumen is clear. Now, based on the age of the person, nature of the block, degree of the block and all those things, sometimes it is advised for placement of stent. Okay. So if the stent is placed, then naturally further block is actually prevented. So the lumen of the artery does not get occluded if a stent is placed. So the cost of the stent, the nature of the stent all differs. Okay. The next option is to go for CABG or coronary arterial bypass graft. Okay. So there actually what happens is sternotomy has been done, sternum has to be split. It is an open heart surgery where actually a venous graft is used to bypass the occluded areas. The venous graft is anastomoted from the trunk, bypassing the occluded area so that a alternative route of circulation is established. That is called as coronary artery bypass graft, CABG. So now we have come to the end of the session where we will also discuss about the veins draining the heart. So most of the venous, 60% of the blood is actually drained through the coronary sinus. This is the largest venous channel of the heart. The remaining 40% of the blood drains through venae caudas minimi, Sebacean veins and anterior cardiac veins. Okay, venae caudas minimi and anterior cardiac veins. Through this, the remaining 40% of the venous blood is drained into the chambers. Now, anterior cardiac veins, they are small veins seen on the right ventricle and mostly they drain the infundibulum and open into the right atrium. Opening into the right atrium, anterior cardiac veins. Venae caudas minimi open through small numerous openings and they can be seen along all the four chambers of the heart, and mostly they are seen along the interatrial septum, on the septal wall. So anterior cardiac vein and then the venae caudas minimi. The next is the coronary sinus. So here you are able to see a large venous channel which is seen on the posterior part of the atrioventricular groove, situated on the posterior part, and it develops from the left horn of sinus venosus. Right horn of sinus venosus gets absorbed into the right atrium as the smooth part of the right atrium, sinus venerum. The left horn of sinus venosus remnant is the coronary sinus, and other one is the left duct of Cuvier. I will come to it. So mostly the tributaries of the coronary sinus are great cardiac vein. It is seen along with the anterior interventricular branch and the anterior interventricular groove. Okay, and then along the circumflex artery to join, or it continues as the coronary sinus. Middle cardiac vein is actually seen along the posterior part. Okay, posterior interventricular artery opens into the coronary sinus near its termination. Small cardiac vein is actually seen along the trunk of right coronary artery. Trunk of the right coronary artery. The small cardiac vein also receives the right marginal vein. The great cardiac vein receives the left marginal vein. Here are the tributaries. The other tributaries are the posterior vein of the left ventricle. Posterior vein of the left ventricle. We are able to see the posterior vein of the left ventricle. So they join actually the left end of the coronary sinus, and then you have the oblique vein of left atrium, which is actually a remnant of left duct of Cuvier. Okay, again the left horn of sinus venosus, remnant of it. It is the oblique vein of left atrium, also called as vein of Marshall. Okay, so that is also seen here, which drains into the left end of the coronary sinus. The tributaries of coronary sinus mainly you should remember: great cardiac vein, middle cardiac vein, small cardiac vein. Apart from that, you have the oblique vein of left atrium and the posterior vein of left ventricle. So here you are able to see the small cardiac vein and the left marginal vein. This is great cardiac vein. These are all the anterior cardiac veins which directly open into the right atrium. So right marginal vein, as I told you, joins a small cardiac vein, and left marginal vein drains into the coronary sinus. So that is about the coronary arteries or the blood supply to the heart. Thank you very much for your patient listening.